The Cancer Research UK ACE programme is very much in partnership with National Health Service and Macmillan Cancer Support. And what we aim to do is accelerate, coordinate and evaluate, hence the name ACE, services innovations within the NHS and look to find ways to ensure that they're embedded within practice once proven. We've had a number of waves of ACE so far. In the first round, what we did was we looked at ongoing innovations that were occurring across England within the NHS and looked to cluster these together to give those groupings a home, if you like. We brought the groups together so that they could learn from each other, learn from best practice, learn from each other's mistakes, and to help them evaluate their results. And if we also coordinated the evaluation across interventions, then we found obviously we had more data to pool and we could draw better conclusions from them. Now in ACE Wave 2, we've had a slightly different model. We've actually put out a tender to centres to be able to run a multidisciplinary diagnostic centre. So this was very specifically to address a problem that exists in primary care referrals. So GPs, when they're faced with patients with symptoms and they have a suspicion of cancer, either can put their patient on a 2-week wait if they think that there's an obvious symptom that requires a certain cancer pathway. But commonly people present with non-specific symptoms. They're not indicative of a certain type of cancer, but the GP might be concerned. Now at the moment those patients are ping-ponging to and fro between primary and secondary care while tests come back negative. And what we set up to do with the MDCs is to give a timed and more rapid pathway to diagnosis for those patients. So the GPs are able to refer these patients in with their non-specific symptom, be that weight loss or nausea or something like that. And they have their tests in parallel rather than in series over a period of weeks or months. And then they can come to a determinate diagnosis much more rapidly. And this we've shown through the MDC centres that we've run over the last couple of years to be very well received by patients and by clinicians alike. So patients are having a better experience of their diagnosis, but are often being diagnosed more rapidly than they would have been before. We've published an interim report which can be found on the Cancer Research UK website. If you look up ACE under Cancer Research UK website, you will find it there. But we're still analysing the data from the ACE Wave 2, the MDC initiatives, and hope to be publishing that both in peer-reviewed journals but also as a report later this year. So later in 2019, hopefully by the summer. We'll see how that goes. And of course, what we're really hoping to see, and it's really encouraging to see in policy terms in the NHS long-term plan for the future, that the cancer programme are looking to expand the number of MDCs, or what they're calling RDTs, Rapid Diagnostic Centres, across England. So we'll see hopefully more of these, and we hope that the new areas that will be implementing these will learn from the lessons that we've proven through ACE.